The premise was to see if photo screening, which is a form of screening without a doctor necessarily in place, may be beneficial for those interim evaluations for kids with Down syndrome. Down syndrome kids have a high, disproportionate percentage of eye issues, poor vision, need for glasses, something called amblyopia, misaligned eyes, sometimes cataracts. So the recommendations of the Down syndrome group guidelines is every 1 to 2 years, but that's cumbersome for families who have kids with special needs that need multiple doctor's visits. Photo screening is a way to kind of fill in the gaps during those baseline periods, during those interim periods for kids who at baseline have a normal exam initially. And what we found is that in terms of time and money, it's really a savings. As far as time's concerned, it's 13 minutes to undergo a photo screening process versus 160 minutes, if you will, to go through an eye examination through a doctor's office with dilating drops and the travel time and the technician time and the whole bit. As far as money's concerned, it's $6 for a photo screening event versus $75 to $90 for an ophthalmologist or optometrist examination. Tammy Yanovich led this study. She was the first author on it. She was an Anna's Angels awardee, and she had just completed her fellowship training with us in pediatric ophthalmology. And this allowed her to have some time and some money to really think about this question and how best to approach it, and then to examine patients, get to know their families, and basically bring this study together. It's a nice thing for a young investigator to have that opportunity, because it just inspires them to do more good work, and gives them the confidence, as well as more in the resume, if you will, to be able to apply for other grant applications and do other bigger studies, which is what she did. You certainly want to maximize their visual potential, just like you'd want to maximize any of their other senses. They're not necessarily going to tell you they don't see well. They may not be verbal in that regard, and so you've got to basically do a screening examination at the very least with interval exams to make sure nothing's developed. As I said, one of the concerns with Down syndrome are the need for glasses, and they could be quite severe refractive errors, as well as the development of cataracts and some other issues. And so those are things that a child who's pre-verbal or non-verbal may not be able to indicate, but would certainly influence their development if they had poor vision. We can get closer to treatments once we understand the biology, if you will, based on what the genetics tells us. And there may be certain clusters or groupings of individuals who have a certain kind of chromosomal abnormality with Down syndrome versus others. And so there's a way of both seeing how that may influence that mutation or the gene defects that accompany that may give us clues about the biology that somehow some people get cataracts and some don't. And there may be some way we can sort of differentiate them, as well as be prognostic, if you will, to the parents about that.